Greetings everyone. Today we are going to look at the various treatment options that your dentist will provide for all the problems that you face inside the oral cavity. Generally, when you go to a dentist, one of the first things that dentist will tell you is to remove the deposits on your tooth surface. This is nothing but oral prophylaxis, tooth scaling, or in simple terms, tooth cleaning. So this is done with the help of an ultrasonic instrument which vibrates at about 25,000 Hz per second. And this removes deposits, stains, and any sort of plaque bacteria that can be present inside the oral cavity. This is a very common procedure that is generally done to improve the oral health, especially for patients who have gum disease. So generally, as a dentist, we advise that these procedures are done every 6 months or 1 year, depending on the amount of plaque buildup that you have inside the oral cavity. Now, scaling is nothing to be worried about. It's just removal of calculus and tartar deposits on the surface of your tooth. You can also remove stains, any stains that are caused by coffee or cigarette, and all these stains can be removed to help improve the oral health inside the oral cavity. The other common complaint that most patients come to the dentist is for dental caries. Now, as you can see in this slide, dental caries starts off as small whitish or brownish spots on the surface of the tooth, and within time, they slowly become into big black spots. And also, dental caries generally starts in the enamel, which is the outermost portion of the tooth, and generally with time, they slowly penetrate into the dentin and finally enter into the pulp, which is the blood supply of the tooth, which then causes a lot of damage for the patient, and the patient can end up with a lot of pain. This type of pain can happen throughout the day or is also seen at night, which is called as nocturnal pain. So when you have pain that is quite persistent, which is increasing at night, generally your dentist might advise you to do something called as a root canal treatment. So what is a root canal treatment? So under local anesthesia, your dentist will then open up the pulp cavity, clean and remove all the necrotic dental caries that are present on the tooth surface, go till the apex of the tooth, which is the most apical part of the tooth, and then use an inert material and fill in the root canals and then seal the top portion of the tooth. So this is a gold standard treatment for saving a tooth, especially that is being broken down with a lot of dental caries. There's nothing to worry about dental caries. It's a very safe procedure, and it is the most successful procedure to save a tooth that is being affected by dental caries. Apart from that, if the dental caries is still on the enamel or on the dentine, various other options are also available which your dentist will give you. The first one is an amalgam filling. Now, this is a silver amalgam filling, which is generally given by the dentist. This is an older technique. It's generally not used too much now, but it is still used in some places. So this will give a silverish hue on the tooth surface, which is generally considered anesthetic over a long period of time. The second or the more recent type of restoration is a composite restoration. So this restoration is done in layers, and this is almost tooth colored, and your dentist can match the type of cement that he wants to use depending on the shade of your particular tooth. You can also use golden fillings to help enhance your smile. And there are also ceramic fillings, which are always called as inlay or onlay fillings, which cover most of the tooth structure and help to remove dental caries and help to prolong the life of the tooth. The other option that a dentist can also tell you is to improve the color of your teeth. So many patients might have discolored teeth because of any medicines that they have taken as a child or because of various environmental factors such as smoking. So this generally causes an anesthetic appearance on the tooth surface, and the tooth might look yellowish or brownish in color. So there are various techniques based on the amount of discoloration that is there in the oral cavity that your dentist might suggest for improving the whiteness of the teeth surface. Remember, this cannot be done continuously. It can be done once or maybe twice, and it helps improve the whiteness of the tooth. It does not remove the tooth structure as such. Now, coming to milk teeth, the most common question that most people ask us is that it's only baby teeth. Why should we retain these teeth? Why should we treat these teeth? Okay. Remember, it's important to retain these milk teeth so that you will have a permanent functional teeth which comes up after 12 years of age. As you can see in the pictures, the baby teeth can also be restored with fillings, or you can give a metal crown, or if it is the front teeth that are generally affected, you can also give a ceramic type of crown for even children. This helps boost the children's attitude, and they are not very sad when they go to school and when they see with their friends. So this can also be done for children who lost a lot of teeth because of caries or drinking milk at night. The other option to prevent dental caries in younger children is to apply fluoride varnishes. So these varnishes can also be applied by your dentist on the tooth surface, in between cracks on the tooth surface, so that if a child takes a lot of sweets uncontrolled, this helps reduce the amount of dental caries that a child would get at a very younger age. So these are options that we generally do to save a tooth, which is its scaling or fillings that are generally done. However, after all of these procedures, if you still lose a tooth, don't worry, there are a lot of ways to go ahead and replace a tooth that is lost. Is it important to replace a tooth that is lost? Yes, definitely, because it helps you improve your mastication. That is the way you bite and chew. Okay, so the first or the most economical option to replace a missing tooth will be by a removable partial denture. So this is a removable option where the patient can remove the denture overnight and can bite and chew with it the whole day. So this is again a long-standing option. The patient, as far as patient is concerned, this is very economical. The other option is the use of a dental bridge. Now, as the name suggests, if you have a missing tooth, support is taken from two neighboring healthy teeth and a bridge is constructed. So this bridge can be made with stainless steel, or can be made with ceramic, or can be made with newer materials like zirconia. So the average lifespan of a bridge is about 10 to 12 years, and this helps a patient to bite and chew. The only disadvantage of the bridge is that a naturally healthy tooth is being reduced for giving a fixed prosthesis. The third option that you can use to replace a missing tooth is a dental implant. Now, most clinics have both dental implants done here, and dental implantology over the last 20 years is also a big thing. So what is dental implants? Dental implants is nothing but placing a dental implant made of titanium inside live bone. So this helps a patient to bite and chew, and this over the last 20 years has gained a lot of interest. So the implant is gently placed inside bone, and then it is closed for a period of 3 to 6 months. And after 3 to 6 months, a post or an abutment is kept on the dental implant, and finally a crown of your choice is given. So this can be given for one tooth, it can be given for multiple tooth. Dental implants can also be provided for a patient who is completely edentulous, meaning he doesn't have any teeth inside the oral cavity. The other common problem that generally teens or younger individuals face is an unaesthetic appearance with the teeth. When they smile, they feel that there are gaps between the teeth, or they could feel that the teeth are malaligned and it's becoming difficult to maintain good oral hygiene. For that option, you should go to an orthodontist, and an orthodontist will tell you what type of braces you require. There are different types of braces available in the market, so your dentist or orthodontist will guide you as to which is the perfect treatment for you. There are metal braces, there are stainless steel or ceramic braces, lingual braces in which the braces are put on the inner side, self-ligating braces which cause less amount of damage, and also something that is trending right now is nothing but clear aligners which a patient can wear. So generally the time for wearing orthodontic braces is about 1.5 years to 2 years. It can be done in younger individuals, it can be done in middle-aged individuals, it can also be done in older age individuals. So there's no time frame for doing orthodontic treatment. It can be done at any time, however it has to be done under correct supervision by the correct orthodontist. The other common problem that you would see in younger individuals, people who are 18, 19 years of age, is the eruption of the third molar teeth, the wisdom tooth. So this starts to erupt only 18 or 20 years of age, and it would be a problem. What are the problems that we generally face? The third molars can push the other teeth to the front. There can be pain in opening the mouth, and you could end up having jaw problems. So as you can see this X-ray, you have a patient with a very badly impacted third molar. So what can be done? So again, in this case, you would have to go to an oral surgeon. So after careful consideration of your X-rays, the oral surgeon will then incise and remove a little bit of gum tissue, and then we'll see the amount of bone that is present covering that particular tooth. And then based on his particular choice and how the tooth is present inside the jaw bone, the surgeon will then remove the tooth completely or in pieces. So this is again a safe procedure. Keeping a tooth that is impacted or that is growing sideways inside the oral cavity is not advisable. It could grow sideways and start damaging the cheek, thereby causing a cancer. It can also give pressure on the front tooth, thereby again causing malalignment or causing inconvenience in maintaining good oral hygiene. So this can also be done. This is also has to be done by a qualified oral surgeon. Sometimes even after doing regular cleaning, because of various other factors like environmental factors or genetics, you might start losing good amount of bone around a particular tooth. This is nothing but a periodontal pocket. So because of periodontal disease, you have bacteria that enters inside the gingival sulcus, which is the space around the tooth, and slowly destroys the gum tissue and the bone. For this also we have surgical options, various surgical options that are available. One of the gold standard methods is something called as flap surgery, where we go ahead and open up the gum tissue, place a material inside and suture it back again so that bone regenerates at this particular site. Okay, so this is called as flap surgery. We use various type of regenerative material. Depending upon your choice and economic concerns, we can go ahead and place this bone graft along with a membrane to cover this at a particular site and help regrow bone that is once lost because of periodontal disease. The other common complaint that generally patients come and tell us is, "Doctor, I understand that we have a problem. I understand that it has to be treated, but sometimes I'm a little scared and apprehensive with the injections and the needles." We use lasers in dentistry also. Okay, so you can ask your dentist if you can use laser for a particular dental problem. For example, as we were talking about periodontal pockets, you can use lasers, soft tissue lasers, which can help remove the infection around the tooth on the gum tissue. Okay, so this is again a non-invasive, simple way. You may or may not need an anesthetic injection depending upon the amount of infection that is present inside the oral cavity. Okay, this is generally painless, no incisions, no sutures, and the working time is also relatively less. Lasers can also be used to treat ulcers which come inside the oral cavity, any small growths that are present inside the oral cavity. All of this can be easily managed with the help of a dental soft tissue laser also. As far as aesthetic complaints are concerned, sometimes you have patients coming to us and complaining that the gum tissue has reduced or the teeth are starting to look longer in length. So this is an aesthetic problem that the patient complaint generally has. This is called as gingival recession, when the gum tissue is not at the neck of the tooth and has reduced a lot more. So this is an aesthetic problem, and this can be corrected with something called as periodontal plastic surgery or mucogingival surgery. So again, after taking proper investigations, taking an X-ray and finding out the way why this gingival recession has come, a periodontist or a gum specialist will go ahead and treat this particular condition. So there are various materials that we can use. We can harvest your own tissue from the palate, or we can use biocompatible materials like collagen to help regrow tissue around the tooth where the gum is lost. This helps improve the aesthetics and help improve the function also of that particular tooth. Okay, so this is called as periodontal plastic surgery or mucogingival surgery. Apart from that, dentists also treat various other conditions inside and outside the oral cavity. Now, sleep disorders are again a big thing that happens, especially nowadays, with many people tending to work from home, working overtime, or not sleeping at proper times. So because of this problem, patients end up snoring or have something called a sleep apnea. So again, you can visit your dentist for this, and they would prescribe a device for you after proper investigation. This device can be worn overnight to help reduce snoring. So this improves your quality of life overall, because if you reduce the snoring, you have a better night's sleep and you have a better day at work. Apart from that, dentists also help manage TMJ point. So temporomandibular joint disorders are also problems that you would see with patients. So these patients would generally complain of pain while opening the mouth, pain when yawning. They would have deviation of the jaw when they're talking or when they're eating. They'll have difficulty in chewing rough or coarse food. These are also conditions that can be managed by your dentist. Not necessarily it has to be managed by surgery. It can be managed by palliative changes, passive changes in your diet, wearing any sort of device that your dentist gives you. However, if it is not treated passively, you can then go ahead and have to go for a surgical option to manage the temporomandibular joint disorders. So these are few conditions that a dentist would treat you. I hope I've enlightened you on few newer conditions also that you might not know. Looking forward to seeing you in other episodes also. Thank you so much.